Hello, we are live right now, and we're going to be answering different questions, right? So your live section, I'm going to start with a question that I came across just now, like before I came on this live section, and it's ongoing. So we need to talk about it. Like the young lady have been seeing her period for 14 days, 14 whole days. So according to her, no pain, nothing, but the bleeding just keeps coming. Like it's just continuing. So she has been bleeding for 14 whole days. Remember, we said a normal period lasts between 2 to 7 days. So if you are bleeding beyond 7 days, it means it's already too much because losing blood, there's going to be possibility of anemia. What is actually coming out is blood, right? So having a period for more than 7 days is abnormal, and then 14 days and counting, that's too much. Please get to see a doctor as quickly as possible because something might be wrong. Sometimes there's what we call dysfunctional uterine bleeding, like you're just bleeding. Sometimes the cause is not known. Some persons bleed like that for a whole month. You're just bleeding is non-stop. Sometimes you might not even have pains with it. Nothing. It just keeps pumping out like that. So I have written her to go see a doctor immediately because 14 days of period, that's too much. Please, if you notice that your period is lasting more than 7 days, please, you should see a doctor, see a gynecologist so that test is done. It is not normal for period to last more than 7 days. So, and for her, the period has lasted for 14 days and it hasn't stopped yet. It's still coming. So please go to the hospital. So you're welcome to this live section. Feel free to begin to drop your question. I have some that are feel free to drop your question and kindly share the live if it is possible, and give it a thumbs up while you watch. But feel free to just keep the questions coming. I am here to answer every single thing, and it is going to be more rewarding that I answer you face to face, because sometimes typing a reply usually is a whole lot. So I might not really give you all the information that you will be needing. So feel free to begin to drop the question. The other one talked about, whether women with irregular period and hormonal imbalance are more at risk of having cryptic pregnancy. I have talked about that in a video before, and I said yes. And that is because of the fact that if you have an irregular period, you are not going to worry when there is an abnormality with your period, because you're already used to being very irregular with your period. When you miss that period, you might not you might not really pay attention to it because you're already very irregular. Okay, Emmanuel Ibrahim, I'm going to answer your question. Kindly give me a few minutes. Let me answer this question, then I come to your question. All right, so irregular period means that you don't see your period every single month. And that automatically mean that ovulation for you is going to be very difficult because you cannot track your cycle. A normal cycle is between 21 days to 35 days. If the gap between your periods every month, like the gap between your period in May and June, is more than 35 days or less than 21 days, it means it is not regular. So you need to monitor it that way. So an irregular period means that the gap between your period every month is either less than 21 days or more than 35 days. So for women with irregular period, they're already used to not getting their period monthly. So even when they are pregnant, they may not know. Some of them may not even know they are pregnant for months, because when it doesn't come, they will feel like, okay, this is like a normal thing. This is what I experience all the time. I don't get my period monthly, so this is just normal. So it's going to be difficult for them to seek help because they are already used to not getting it. So yes, women with irregular period actually will be more at risk of having cryptic pregnancy. And what causes irregular period most times is hormonal imbalance. Now, there are hormones that regulate the woman's cycle, the female's reproductive cycle. Estrogen is there, progesterone is there. We have the follicle stimulating hormone, the luteinizing hormone. These ones help with ovulation. All of the different hormones help to cause that, make the cycle just go around normally, have your ovulation, have your period, and all that. But when the hormones are imbalanced, like they are not enough, you're going to begin to have all this issue. If you notice that you have been very irregular, it's good that you do a hormonal profile, you see a doctor, and then tests are prescribed, interventions are given to ensure that your period becomes like more regular, and then that means your chances of getting pregnant is going to be higher. So let me answer your question, Ibrahim. You see, my question is regard to birth control, when is safe to have sex before ovulation? Okay, this is going to be depending on the cycle of the individual, that's the woman involved. For somebody who have a 21 days, sorry, so for somebody who have a 28 days cycle, which is the standard, the day your period start as a woman, the day your period start until 9 days later is safe. That is a safe window. That's, you start counting from the day the period starts till the ninth day. Let's say the 8th day, because from the 9th day you're already fertile. So that 8 days, the day your period starts till the 8th day, that's a free period for you, like, right? So around that time you cannot get pregnant. It's a safe window for you, so you can make use of that. And then from the 9th day of your cycle, you're already fertile till the 19th day of that cycle. All right, so let's assume that your period started on the 1st of June. That means that 1st of June till 8th of June is safe, like you don't have any problem. You can actually have unprotected contact and not get pregnant. That's 1st to 8th of June. So from the 9th of June till the 19th of June, you are considered fertile. And within this period, you're going to get pregnant if you have an unprotected contact. And that is because from the 9th of that month, which is the 9th day since your period started, you are already fertile. Ovulation is already happening. Normally, ovulation is going to happen on the 14th. All right, so that 9th is like 5 days before the 14th. And the reason you're told, okay, this period you should be careful, is the fact that the sperm is very strong. It can stay alive for 3 to 5 days after it is released. And that automatically says that if you had an unprotected contact 5 days before your ovulation, it means that there is a possibility of pregnancy happening. And then if you have 5 days after ovulation, there is also a possibility of pregnancy happening. So the 5 days before your ovulation and the 5 days after ovulation are very sacred period. They are the fertile window, and you need to be extremely careful. And the 5 days after is also there because ovulation may not happen on the 14th that you were actually thinking is going to just happen that day. It might happen earlier, and it might happen later. So you just extend, that window to make sure that you are covered, that if there is an ovulation, then you will have a very high chance of getting pregnant within that window. So between 9th of your cycle, the 9th day of your cycle to the 19th, you are unsafe. That is a fertile window. So from the 20th till the day the next period is going to start, you are still safe. So first day, okay, sorry, I some network, right? That's right? Okay, so like I was saying, so from the first to 8th day you are safe, and then from the 20th till the day the next period comes, you are still safe. So that is how you know the safe window and the fertile window, just in case you want to do natural family planning, which is very, very key. Because over time, there have been lots of reports from women regarding the what happened to their body after family planning. All right, some of them, so many of them have reached out to me to say, since they came off their family planning, since they stopped using their family planning method, they have not gotten their period. Some got their period, but still it is not regular, and so they're having issue conceiving again. So it's very crucial that you know this natural family planning method. It's going to help you because it is not going to affect your hormone. It is not going to disrupt anything in your body. So you are safe. And then you know that, okay, if I need to meet with my partner during the fertile window, you use the barrier method of contraception. That way, you will be able to get pregnant quickly when you decide again that you want to try for pregnancy. But for use of contraceptives, especially for the hormonal ones, like the Provera, the injections, I think that 3 months injection. So many women have complained bitterly about how the aftermath, the after effect of it on their period, ovulation, and even conception. So it is important that you understand this natural method of family planning. A lot of women have used it consistently and it has helped them. So you know it. Once you understand what your cycle really is, it makes it very easy for you to know that period when you are fertile, and then you avoid it in case you do not want to get pregnant, and you will not have issue preventing pregnancy. So that is very, very, very important. So keep the questions coming, but if there's no one, we're going to look at one other one. And she said, can I still get pregnant after an ectopic pregnancy? I already did video on this, but let's talk about it just in case there might be a concern. Now, before everything, let me just give us an overview of the female reproductive system. As a woman, you have a womb, and from your womb there is 2 fallopian tubes. There is a right and the left fallopian tube. And then you also have 2 ovaries, the left and the right ovary. So when the left ovary produces egg for a particular cycle and you get pregnant, it means that the fertilized embryo is going to pass through the left fallopian tube into the womb to attach. And even the right ovary that ovulated in a particular month, the fertilized egg is going to pass through the right fallopian tube to implant in your womb. But in a situation whereby the fertilized egg gets trapped in your tube, it is going to cause the tube most times to rupture, because the fallopian tube is very narrow. It's not wide enough to carry a growing baby. So the fallopian tube is going to rupture, and then you're going to have like a ruptured ectopic pregnancy. And once this rupture happens, it means that that tube that got ruptured is going to be cut off, surgically removed, and you will be left with one single tube. Now, this does not mean that you're not going to get pregnant anymore. You are still going to be getting pregnant. The only thing is that your chances have been reduced by half. So you're going to have a little bit more difficulty getting pregnant. But you also have to remember that a woman who have had one ectopic pregnancy before is more at risk of having another ectopic pregnancy. And once you have 2 ectopic pregnancies, you are no longer going to be able to have children, except maybe through an assisted reproductive techniques, maybe like an IVF and all that. So what you need to do if you have had an ectopic pregnancy before is to discuss your conception plan with your gynecologist. That way, you are monitored for infection. If there is any infection that could pose a risk of another ectopic pregnancy, you are evaluated and then it is treated. And then you are guided through your conception process to ensure that another ectopic pregnancy does not happen. So that is what will happen. And it does not mean, so for the person that asks, it does not mean that you're not going to have, and you will not be again. You can get pregnant again, despite that one of your tube has been removed. But just ensure that you are getting pregnant under the supervision of your gynecologist so that you do not have another ectopic pregnancy. Now, what are some of the reasons that can cause you to have ectopic pregnancy, especially when it is a tuber pregnancy? Because when you say ectopic, it means it's outside the womb. So it can be in the ovary, it can be in the stomach. Yes, pregnancies, babies enter into the stomach and they can definitely not survive. So they are removed surgically. So when it's in the tube, it is possible that there was a blockage in the tube that did not allow the embryo to, successfully or freely pass through the tube. And this can be due to inflammation from infection. When there is an infection, there is inflammation. Sometimes you go and then you do a scan and the scan said you have pelvic inflammatory disease like PID. That's an infection causing swelling of your reproductive organs. Now, if this is not treated and that inflammation is there, when the egg fertilizes and need to travel through, there will be no much space for it to pass. And so it just hangs in the tube there and begin to develop. And because the tube is not big enough or cannot expand like the womb to contain the growing baby, the tube just ruptures. And that is where you have that ruptured ectopic pregnancy. So ensure that infections are not left to chance if you're a woman. Don't just assume that, oh, okay, I'm having all these symptoms, maybe a discharge and all that, pelvic pain, you just take it lightly or just treat it shabbily. Ensure you get appropriate treatment for every infection that you may be having as a woman. So that is it. So yes, despite you've had one ectopic pregnancy and you've had one tube removed, you can still get pregnant. Only ensure you are getting pregnant under the supervision of your gynecologist. Okay, I hope I've answered that. So negative test but still pregnant. That's the other question. Negative test but still pregnant. I know that's a concern of so many people. Like the test is just negative and pregnancy is there. This is aside, like, let's say cryptic pregnancy, aside the fact that, okay, women have cryptic pregnancy, they are pregnant and the test is negative. It is also possible to be pregnant, like for real, like the pregnancy is there, the scan has picked it up, but the pregnancy test is still negative. It's very possible. And some of the reasons are not far-fetched. One is slow production of the pregnancy hormone. Now, the pregnancy hormone is HCG. That's the human chorionic gonadotropin. That is the hormone that is picked up on the test strip. So when you do a pregnancy test, what gives you that positive is that HCG hormone. Okay, and it is usually produced when the fertilized egg attached to the womb of the uterus. That's when implantation happens. 2 days after implantation happens, that hormone is secreted. But in some women, the secretion of this hormone is very slow. So even though they are pregnant, they have missed their period, they still get negative pregnancy tests. So that is one of the reasons you might be pregnant and then you're getting negative tests. I've seen it happen firsthand to a colleague of mine. She got a positive at 12 weeks. And that it was even the ultrasound that first picked the baby, because both the urine pregnancy test and the blood were all negative. I'm talking about someone who is a medical personnel working in the hospital. So you can imagine the multiple tests she was taking just to ensure that we get a positive urine serum, and they were all coming back negative. The scan was able to pick this baby at 12 weeks, but test was still negative. It was later on in the pregnancy the test became positive. So sometimes this happens, and so you might not be able to get a positive test due to these circumstances, and then the pregnancy is there but the test is negative. So this is one of the reasons. Another reason you might be getting a negative test despite pregnancy is the test strip you are using. Now, test strips vary, like they differ. There are some that are more sensitive than others. And also, there are some that are already out of date. Pregnancy test strips are not things that people buy all the time, like paracetamol. So there are people who might stock this and not get customers for it. And so it's left there over the counter for months, and nobody is using it. The temperature of the area is acting on it, everything. And then at the end of the day, when you get to go to purchase, it is still sold to you. And when you use it, it's going to give you a faulty result. So that is another reason you might actually get a negative test, despite the fact that you are pregnant. Another reason could be that it is a cryptic pregnancy. So it could be that it's a cryptic pregnancy, and so it is there, but it cannot be picked up. So cryptic pregnancy could be another reason why you're pregnant and your test is negative. It is still a mystery how the cryptic pregnancy test always goes comes out negative, both urine and blood. That is why I always tell people, like, the woman's body, like the human body, is very, very complex, and the processes that happen in our body is very, very complex. And that is why it is not good to just look at somebody and tell the person you don't know what you're talking about when the person talks to you about her body or his body, because there are things that happen that you cannot even explain yourself. So it is very, very possible to be pregnant and then the test is negative. So cryptic pregnancy could be the reason you're pregnant and the test is negative. For some women, at 20 weeks, the test become positive, and then the pregnancy is picked up on the ultrasound. For some others, it never be it doesn't become positive. Like, they do not even know, because maybe you have tested first month, second month, third month, you will just give up. And then by the time you're getting to 4 months, 5, 6, 7 months, that you are supposed to get your positive result, you are no longer checking, you're no longer scanning. So it might just go unnoticed until delivery. All right. So most of the women with cryptic pregnancy, if they had checked around the time, around the time that they were very much advanced, maybe they would have been able to get the results they wanted. Noreen, good to have you. Is it also possible for an ultrasound to also miss a fetus with cryptic pregnancy? Sure, it is. It is. So both the ultrasound and the test most times misses it. That's where the problem comes mostly with it. And that is because of the position of the baby in the womb. The uterus is pear-shaped, like it's so small, but surprisingly, there are positions that uh, um fetus can assume in the womb that ultrasound may not pick that baby up. So the position of the embryo or the fetus in the womb and the shape of the uterus are some of the contributory factor to why ultrasound do not pick up the baby. So yes, it is very possible for ultrasound to miss the baby in cryptic pregnancy. So it is very, 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 very possible. I've had it such um experience over and over, like real life experiences of people. Ultrasound do not get to pick. There were some who were lucky to get picked up at 7 months, some earlier, depending on sometimes the sensitivity of the ultrasound machine and even the expertise of the person performing the ultrasound. Because there are people that are not trained to really use the ultrasound machine, and there are people that are highly trained for it. So they would know those that are well trained will know exactly what to look out for. And also, just the fact that your pregnancy test is negative, they might not really pay attention to checking very well. Because most times in early pregnancy, what happens is most ultrasound centers decide on going for trans vaginal ultrasound. That's the TVS, because it is more sensitive and it gives more accurate results. But in a case where you have a negative pregnancy test, you might not even, you're not sure. So you cannot even insist on the method of scan that will be used for you. So that is what happens. And so the scan is performed and everything is just negative. Ultrasound is not picking. So that's one thing. It's very, very possible for that to happen. Yeah, so that is it. So the fetus kind of hide from the ultrasound. Yeah, but sometimes at the later stage of that pregnancy, it gets picked up. And like I said earlier, the only reason most people go until delivery without knowing is the fact that they will not even be going for ultrasound at that later stage, because they have been testing and scanning during the early days of their pregnancy and getting no result. So at that later stage, they may have given up, just assume that, let me just relax, nothing is there. Meanwhile, it is actually there. So that's maybe some of the reason why a lot of women just go unnoticed until delivery. All right, I talked about a lady in my town here who got hers picked up at 7 months. Okay, and she had negative tests all through, and so they were just treating her for infection, urinary tract infection, PID, this and that, because her period was not, it was coming, but was not as it should be, and test was negative. So they were just treating her for infection until 7 months into the pregnancy before an ultrasound was able to pick it up. She was a student, and it wasn't funny at all for her. Does this cryptic pregnancy last? No, it's almost 4 years. Well, Gabriel Paito, please, how long does this cryptic pregnancy last? My wife is almost 4 years. Now, the truth is, the longest in history is 375 days. That's a little above 1 year. So that is the longest that is recorded in history. So for now, there have been no change to that duration. But human body differs. And like I said, the human body is very complex. And so what like what happens to one might not be exactly what may happen to the other person. So there is so much complications with the human body that you cannot just say for sure, okay, this is the standard. Because usually we know that the duration for pregnancy is 9 months, 38 weeks to 40 weeks, the woman gives birth. But now there are women who go beyond 40 weeks, they are post date and they still give birth. And now the longest cryptic pregnancy that was captured in history was 375 days. Who knows, there might be others that have gone beyond 375 days that have not been captured. So yeah, the longest that is documented is 375 days. So I don't know if you've taken your wife for comprehensive check. I will advise that she goes for a comprehensive check to ensure that every other reproductive system issues are ruled out, so that she could get the adequate intervention she needs to help her relax and also increase her chances of getting pregnant. Now, one thing that I always advise is that you do an ovulation test. Mr. Gabriel, I hope you hear me. You get an ovulation test strip. The ovulation test strip is just like the pregnancy test strip. You get that test strip, and then if she knows her cycle and she's still getting her period, try to test for ovulation within her fertile window. If she has a 28-day cycle, her fertile window is going to be starting like 9 days after her period have started, and then 14 days after her period have started, she'll be ovulating. So around that period, you do the ovulation test. Just do it and then see if it is going to be positive. If it is positive, it means that she is still ovulating. And normally, if you were pregnant, you're not supposed to ovulate anymore. So there will be no luteinizing hormone to be picked up on the ovulation test strip. So you can do that to confirm and be sure that, yes, there is actually still a pregnancy, or we need to start trying for another. So that is very important. So comprehensive tests to be done is very important. I know that there are no much provision or support for cryptic pregnancy in most of our hospitals. So you just try as much as you can to um, get all those interventions done. That is very, very, very important. So keep the questions coming and kindly hit the like button. Hit the like button. Hit the like button. So the next question is, what do you do if ultrasound and blood work isn't detecting pregnancy? That is one of the issue a lot of people have. Like ultrasound and blood tests, urine, everything is not detecting pregnancy. What do? You're going to give yourself time. If none of them are picking up your pregnancy, give yourself some time. All right. So time is going to define every single thing. It's going to give you the answer you need. So if you've done it and then it is not positive, and then ultrasound did not pick it up, wait again for like 2 weeks and test again. And if possible, have another ultrasound done again after 2 weeks. So you just be checking like that, especially for cryptic pregnancy. The best way to monitor it is to do your test every 2 weeks, like 2 weeks apart. You do it this, you take the test this week. After that, you take it again the next week, like that. That is how you are able to keep a tab on pregnancy if you really need to diagnose it. So yes, if you've done ultrasound, you've done your blood work, and it's still negative, give yourself some time and still test again. That is what you can do if you feel that you're pregnant and you're not getting the results that you need. Continue to test, continue to search, continue to get checked. Hopefully you are going to get the results that you need with. That's very, very important. Okay. So the other one says, how soon can you pregnancy test? That is also very important. The time you're going to get a positive also depends on so many factors, ranging from when ovulation happened, whether you actually calculated ovulation very well, and also on the build-up of the hormone in your body. So ultimately, the best time for you to test is after you have missed your period. That is the most appropriate time to test. Now, this is because ovulation might happen later than you expected. There are people that 8 days after ovulation, they're already testing positive. Some 7 days after ovulation, some 10 days, some 12 days after ovulation, they're already testing positive. But there are some that may not test positive until they have missed their period. So you need to take that into consideration. Now, with a multiple pregnancy, it is possible to get positive test, because since it is multiple pregnancy, like twins or triplets, the production of the HCG hormone is going to be higher. So it is possible to get your positive pregnancy test very, very, very early than when it is one. So that can also affect your test result. And then also the sensitivity of the test strip and all that can affect it. But overall, the best time for you to test for pregnancy is when you have missed your period. That is the best time that you can actually rely on the results you get, and also be sure that you're going to get um, an accurate result. So that's very, very important. That's important. But overall, what I would always advise for every woman is to continue to watch their body. If you are in your childbearing age and you intend to get pregnant, make sure that you are in tune with your body. Understand ovulation, understand your fertile window, understand your weight, like your body. Know which weight works for you. Don't just assume that everything is okay. You're just eating, you're just living your life, you're adding weight or you're losing weight or something you don't really mind. But all of these are very important. So if you're in your childbearing age, exercising from time to time is very important. Taking your folic acid, one tablet every single day, is also very, very important. So you need to do all of this if you are trying to, you're going to conceive. Even if you're not yet ready, you can prepare your body. Eat healthy. I always say it's pineapple, you can eat apple, avocado, you know, fish contains omega-3 fatty acid, which is very important. You eat all of that. Proteins, generally just eat healthy. Vegetables, they are very, very important. They will help prepare your body for the task ahead. It might not be happening like now, immediately, but it will just get your body ready for the future. And your lifestyle you begin to avoid as well. Smoking, drinking, there are things you begin to cut off as you begin to think about having babies, because these things can affect your ability negatively. There are some that will increase your risk of having children with abnormalities. There are some that can also, increase your risk of having ectopic pregnancy. There are some that will increase your risk of having miscarriages and all that. And you need to watch all of these, put them into consideration, and ensure that you take adequate care of yourself to avoid you and any negative consequences. So those are very, very important points to take note of. So knowing ovulation is also very important. So many people ask me question. They just drop the question. They will be like, "Okay, my period started on the 18th. When am I ovulating?" And I'm like, it's going to be difficult for me to tell you when you're ovulating because I don't know what your cycle is. Okay, I know that for somebody with a 21-day cycle, from the seventh day, like on the seventh day after your period, you're already ovulating. Because you have a 21-day cycle, ovulation is going to happen very early for you. So for such person, 3 days after your period, you're already in your fertile window. So it's going to be very easy for you to get pregnant because ovulation is very close to when your period is going to end. And that is why some women will ask that, I think I got pregnant while I was on my period. That was not what happened. You didn't get pregnant while you were on your period. It happened days after your period, because the ovulation period is very short. It's close to the time the woman sees her period. So and then she had unprotected contact during the period. The sperm would be there until when she will ovulate, which is just on the seventh, like 7 days after her period, she's ovulating. That's very close. So you can get pregnant then, and then you assume that, okay, maybe I got pregnant while I was on my period. No, the ovulation for short cycles happen very, very early. And then and for 22 days cycle, it's still going to be earlier than for 28 days cycle. So it is important that you know your cycle first of all. And I always I have said this over and over, that for you to be able to know that yes, this is my cycle, you have to track it for at least 3 months. 3 months before you be able to know that, okay, the gap between my cycle every month is 20 days, is 30 days is 28 days, and then that way it will be easy for you to track ovulation. But if you have not known that, then it is going to be very difficult for you to track ovulation. Now, for women with irregular period, um, tracking ovulation is a lot more difficult, but it is doable. I posted a video about it last week or so. So, and then we calculated you need to track for at least 6 months, 6 months of tracking, and then you get the lowest, like the smallest of all the period. Okay, for January, the gap between my January and February period, it was 24 days. Okay, the gap between my February and March period was 30 days. The gap between my March and April period, was 40 days. You get all of this. Then you subtract 18 from the smallest period that you had, the smallest cycle that you had, and then that is going to be like the beginning of your fertile window, whatever you get. For instance, you say 18 minus 24, you get 6. So you know that in this new cycle that your period started like this, from the 6th day of that cycle, you are already fertile. And then you get the number with the highest cycle, cycle duration you had in the entire 6 months. When you say 30 days, 30 minus 18, you get 12. So that 12th is going to be the last day of your fertile window. So you mark. So between 6th to 12th of the month you are in now is going to be your fertile window. That's for irregular period. So if you need to get better understanding of it, then you should check out my video on how to calculate fertile window for irregular period. That way you're going to get a better understanding of that concept. So that is it. So I'm going to wait for more questions, and then before we go into looking at the other questions that we have here. So I'm just going to hold on a little bit and then see. So like I said before, a normal cycle is between 21 to 35 days. That's very, very key. So if your cycle is more than 21 days, it is already irregular. If it is less than 21 days, it is already irregular. And if it is more than 35 days, it is also irregular. So it has to be between 21 days to 35 days. And also it is important to note that if the change, like the gap or the difference between your cycle every month is 7 days and below, your cycle is still within the normal range. Okay, so I assume that this month my cycle was 24 days. Next month the difference between the cycle was, okay, my cycle was now 30 days. The other month my cycle is now 28 days. The other month my cycle is 26 days. It's still regular because it's still within the 7 days duration. The difference is still within the 7. But if for anything it is more than 7 days, so for instance, your period this month was 24, the cycle was 24 days, and then your period the next month, the difference was, okay, your cycle was now 33 days. It is already irregular because the difference between them is more than 7 days. Those linear nigra always indicate pregnancy. Well, usually when you're pregnant and there is this, stretch, the linear nigra becomes visible. The linear nigra is kind of there, but is made visible most times by pregnancy. And then sometimes if there is anything that stretches your womb or puts pressure on your abdomen, it can actually cause the linear nigra to be also visible. But basically, it's usually pronounced with pregnancy because that is when the womb is stretched. It becomes really, really visible. So that is one thing. So it is more pronounced with pregnancy, but it is always there. It has always been there. It just becomes more visible with pregnancy. Yeah, so That is what I think happens with the linear Libra. It's just like stretch mark. Oh my God! When there is that the stretching of the the womb, the stomach, and all that, you begin to get stretch marks and all. So some of those things are actually as a result of pressure that is put on the different organs, the veins, the arteries, and all of that, and whatever. So, did I answer your question? I hope I did. Ooh, hope I was able to answer, right? Okay, so let me know if I answered it as you would have wanted. And if you have any more questions, feel free to ask. So I'm going to wait for more questions to come in. So send in those questions. Keep them rolling. Keep them rolling. Keep them rolling. Well, some people like reached out to ask for drugs for treating cryptic pregnancy, when to begin to take, prenatal vitamins in cryptic pregnancy. Okay, okay, Noreen, good to know that. When to begin to take prenatal vitamins and all that. Like I said earlier, if you are in your childbearing age, just be taking your folic acid. Just keep taking your folic acid. It's just very important. All right, it's going to help you. So you just be taking, whether you feel pregnant or not, continue taking your folic acid tablet. It's very, very important. There are no specific drugs to treat cryptic pregnancy because, of course, no matter the kind of pregnancy is not a disease. Most times, what is treated during pregnancy are other diseases or infections that find their way into your body. Sometimes you're pregnant, you get malaria. Malaria is treated. You have urinary tract infection. The infection is treated. You have typhoid. The typhoid is treated. So it is those illnesses, those diseases that are being treated, not the pregnancy itself. Yeah, so that is it. So there is no drug to treat, say, the pregnancy, cryptic pregnancy on itself. But if you are sick during the pregnancy, you are treated. The only thing with cryptic pregnancy is the fact that um, the wrong medications might be used. Because during pregnancy, there are medications that are prohibited, like don't use this, don't use this is too strong, this can affect the pregnancy. But with cryptic pregnancy, all these are not, the pregnancy is not known. So it is just very possible to be giving the wrong medication. You're just taking the wrong medication, and that can expose the growing baby to some abnormalities. But surprisingly, most of the women that gave birth through cryptic pregnancy had very normal babies, like perfect babies. So, like the nature have a way of protecting itself, defending itself. And that is what just happens, because sometimes you're pregnant, it's cryptic pregnancy, you're not aware, you are sick, you go to the hospital, your doctor prescribes all manner of antibiotics, all manner of medications for you, because they are not aware of what is going on. So you're taking this medication, a medication that would normally affect a baby or affect the pregnancy, but it does not affect it. So the body just have a way of just keeping itself fine, defending its own environment, protecting the growing baby in your womb, and helping you bring forth a very healthy baby at the end of the day. So that is a mystery, right? That's a mystery. But generally, if you're a woman of childbearing age, that folic acid every day is very good. You just take it. You can take it at any time of the day, whether morning, afternoon, or evening, whenever you want. You just take it. You can keep it on where you'll be able to see it and remember, whether maybe on your kitchen cabinet, on your TV stand, somewhere that you can pick. You can keep it on the dining table so that whenever you want to eat, you see it, or you keep it in your wardrobe where you dress. Places that you access frequently, keep it there so that once you see it, you remember, and then you can take it. It's very easy, and it's also very affordable. It's not expensive, and it's something you can get over the counter. So you just try to do that. Just take it. It does not have any negative impact, and so that's very very important. Now, one thing is, if you notice that you're having irregular periods, sometimes it might be related to hormonal imbalance, and it can be PCOS. And so treatment, sometimes if you report, because a lot of women do not report, they just keep these things to themselves and just assume that it's going to normalize. So 1 year passed, 2 years, 3 years, it has not normalized, and then it's reducing your chances of conceiving. So what you need to do is report if you're having maybe irregular cycle, and that means that either your cycle is less than 21 days or more than 35 days, and you're not getting it every time. Please report it. You could be placed on birth control. Surprisingly, birth control will help make your period regular. So you could be placed on birth control maybe for 2 3 months, and then if there are other symptoms, you'll be treated also for it. And before you know, your period is back on track, your fertility is back on track, and then you are able to conceive. So please don't just assume, especially when it has to do with your reproductive system, because the reproductive system of a woman is very delicate. Right from the outside, it's very delicate. The vulva, till you get inside through to the cervix, to the womb. It is very, very delicate. And it's very easy for the woman to acquire infection than a man, because the female reproductive system is open. So infection can easily, you know, come into the female reproductive system. And that is why you need to be very careful what you use in cleaning your vulva, your reproductive tract. Be very careful what you use. There are people that use medicated soap or just soap. You use soap, you want to wash it so well. Please be careful. That can expose you to infection. There are those that douche, like if they have not douche, they don't feel like the vulva is clean enough. They need to douche, they need to use different feminine products. That can expose you to severe consequences. Infections are there. Now, the female reproductive tract is self-cleaning. Like, it can keep itself clean. It can just maintain its environment. But if you're using all the different chemicals on it, it's going to cause the bacteria there, the normal bacteria that are helping to maintain that place and keep it protected, is to become disrupted. And once that happens, you're going to be exposed to infections like the bacterial vaginosis and other reproductive tract infection. And I know you wouldn't want to do that. You wouldn't want to expose yourself to that. So it is important to always maintain reproductive tract environment, but devoid of chemicals. Okay, use more of cotton on the waist than maybe uh, um, nylon, because it has more of fancy designs, but that does not mean it is the best for you to use. Use more of cotton. That's going to help better. And also ensure always that you maintain an adequate period hygiene. Know when you should be changing your pads and all your undies and all that during your period. That is very, very important. So you should look at all of this and just know exactly what to do for yourself per time to ensure that you get the maximum, results, and also have a healthy reproductive tract, a healthy reproductive system. That is very, very, very important. So I think we've literally we've answered almost all the questions we have. There are more, but I don't know. Maybe we'll check them out. Stay far away. Okay, this one said, is it possible to have that heartbeat check ourselves by hospitals despite having negative tests? Hospitals don't consider us to be normal. Yeah, that's a problem, right? Some are not, they don't believe in what you're saying, so they really do not take action when it comes to your symptoms and your complaints. That is it. But if they can actually pay attention, I think having the heartbeat assessed would do a whole lot, will go a long way, will go a long way. If it was somewhere that you're familiar with, like let's say like around here, you can actually walk into an ultrasound center that is not affiliated to any hospital. They are just a business center on their own. So you can walk in there and they can attend to you. You just tell them, okay, this is what I want to do. This is what is happening to me, and this is what I want you to do for me. They can they can check you, assess you, do everything for you, provided you have the financial capacity to pay them. I don't think it's like that where you are. Noreen, is it like that? Which country are you? All right, but because if it is here, you'd be able to get what you need, because you don't need to book an appointment to get checked. You don't need to book any appointment to get assessed by a sonographer. You just get there are so many of them. Like you can just you walk in there, they wouldn't even ask you for a doctor's referral. All they are going to ask you is which ultrasound do you need. You could decide to tell them, okay, you want an abdominopelvic, you want a pelvic, you want an obstetric scan. And when it is an obstetric scan, what the sonographer is going to be concentrating on is your womb. Will concentrate there to check what is there. Every single thing that's there is what is going to be adequately checked and then handled for you. So it's very, very important. So that is it. So most times, to going to a regular hospital, it becomes so difficult, because if you see a health personnel, say you see a doctor, the first thing they're going to request is maybe a test. Once the test is negative, they wouldn't even want to even maybe push further, say maybe for an ultrasound or anything. And when you try to suggest it, it might not be given to you, like because they feel that you are not pregnant, so there's no point giving you an ultrasound. After all, the test have said the test is negative, so what's the need? So it becomes so difficult. But if it is here, you can access like ultrasound centers without having to go through maybe a doctor or having to book an appointment and all the different processes you need to go through. So it's really difficult, honestly, because a lot of people do not believe. So many are not even ready to just understand what you're going through. So it's more like you're left alone, and then you're just confused about what to do. But like I said, the best thing you can do for yourself is to ensure that you continue to eat right, exercise, be happy, and then just give time. And also keep checking your during the ovulation test. Get the ovulation test strip. I don't know if you've done that before. Get the ovulation test strip and do the test from time to time during the period that you feel might be your ovulation period. Get the test strip and do your test. Let's see what that's going to hold for us. So that's also very, very important. So if the hospitals are really not supporting or giving all the support they need. Just try as much as you can to create your own happiness. Just give yourself time, and everything will eventually just fall into place. Everything will be fine eventually. So that is said. That is very, very, very important. So let's get questions, more questions, more questions. Which other this one? What do you do if okay? How soon? Active test. Do yeah. Can I see? Yeah. So literally, um most of the questions I took down are almost like exhausted. But so many people have been asking that I calculate ovulation for them. Most of them are not here. So I am not going to do that. If they were here and they had dropped their LMP and their cycle, then we would have been able to calculate their ovulations for them. So, and there are so many videos on the channel about how to calculate ovulation and all that. So I believe that um, any one of you who have that question can actually check through to get those get the answers you need from those videos. That's going to help. So there are so many women who are actually going through the situation. Some are going through other reproductive health situations, like some have uterine fibroid, some have ovarian cyst that needs intervention, but they are handicapped. So by the grace of God, as God helps us to grow, we would be able to get to a point where we can just support some women, get some minor maybe tests done, some minor investigations done. So we are hoping that God blesses us. For now, there are no revenues yet from YouTube, but hopefully with time that's going to begin to happen. We now have super chats and membership for subscribers who might want to become members of the channel. And then by so doing, we get to communicate more, like on WhatsApp, through phone calls and all that. And with all of the little we're able to raise, we'll be able to help a lot of women. There are women that need to get HSG done. That's the hysterosalpingogram. Yeah, hysterosalpingography. Yeah, that's a procedure that's done to visualize, I mean, to take a visual picture of the womb, the tubes, and everything to make sure that it's okay, that the womb is free from maybe tumors or whatever, the tubes are open, are patent, and all. So, for most women who have been trying to conceive, this test is usually recommended to be sure that the tube is open, because if the tube is not patent, then fertilization it will to happen, because the sperm will not have where to travel through to go fertilize the egg. And in some cases, when there is a narrow, um, pathway through the tube, despite the blockage, and the sperm is able to even pass through to fertilize the egg. When the egg is fertilized, the embryo cannot travel down. You just get trapped there. And then you have cases of like ectopic pregnancy, ruptured ectopic. Okay, network. They do not have access to some amenities. They do not have access to get these tests done. So by the time God begin to, bless us from this platform, we'll be able to do all that. So it's just an encouragement to anyone who's a subscriber. If you feel like you can become a member of the channel, there is provision for the channel membership. Is not very big. There is super chats and super thanks. All of that can help us reach that goal of helping women with reproductive disabilities to be able to access care, and also help women who are also in need of getting comprehensive checks. There are some that have told me that they feel like they've been pregnant for up to 1 year, 2 years, but unfortunately they cannot get the needed tests done. They cannot get the needed intervention because they cannot afford it. So by the grace of God, with time we'll be able to reach out to more women, encourage them, and also help them through their journey. As women, we need to stand for ourselves. Women go through so much. As soon as you reach menarche, you have that first period as a young girl. You know that you need to go through a lot of processes. Every single time. You go through so much all through your life until you get to menopause. When you get to menopause, it's another journey altogether. So women need to be encouraged, women need to be helped, women need to be supported as much as possible. And we can actually do that if we join our hands together and say enough is enough to the suffering of women, like especially when it has to do with the reproductive system and their reproductive health. That's very, very key. Yeah, so I'm still going to wait a little bit for questions before we move further. Or just round up. Say, it is a boy. Is it a boy? Person six. So these are some myths. So some um old wives' tales about having a boy or girl. So some of the old wife tales are be old wives tales. One says heartburn during pregnancy means is a hairy baby. So if you're having a lot of heartburn, it means your baby is going to have a lot of hair. Is that true? True or false? Low fetal heart rate means it's a boy. What? Yeah, that's another old wives' tales. If I have severe nausea, it is a girl. Woo! Old wives' tale, another one. Hair dyes can be harmful to the baby. Really? Another one. I shouldn't get I shouldn't get the flush. Okay, the flu shot if pregnant, okay? And I should not have during pregnancy. Well, these are all old wives' tales that are really not scientifically proven, but there are some people who believe in it, and it has worked for some. So that is it. So I think we might just end this live stream at this point. But before then, I'm just going to give like 3 minutes to see if we're going to get some more questions. Yeah, let me see. So always feel free also to drop your question whenever you have one. I will get the question and I will answer it just like I'm answering right now. So it is very important that you get your questions in. Yeah, and then I'll respond to it. But I think in my subsequent life, I'm going to be responding to questions later on in the live stream, like after we've been able to discuss most of the pressing issues, then I will respond to question. I think that would be the best way to go. That will keep more people watching the live for longer period, and that's going to help them also, gain more knowledge, like other knowledge, rather than just getting their questions answered and then they bounce. Yeah, so that is yeah, so 1 more minute left before we call it a day. Okay, so I think we're going to end it now. I'll see you all later. If you've not liked, if you've not subscribed, if you have not shared, please try and do so other people get to benefit from this. Thank you all so much, and I'll see you again later. Bye.